The Greater Brisbane lockdown, get some analysis from a different perspective. I'm joined by Professor Catherine Bennett, Deakin's Chair in Epidemiology. Professor, thank you for your time. We've heard that tourism perspective. From your health perspective, what do you make of the lockdown off the back of a handful of new cases?
Look, I think it sadly tells us today that this is bigger than we actually understand. And I think that's the real concern here. We've got cases we're not sure how they link up. We've got a cluster that we know ties back to that hospital because we've matched the variant responsible for the latest infections. But we actually still don't know how that link happened. And while we might have found one case that predates the current cases, the brother of the first case that was announced over the weekend, that still doesn't tell us how it connects back to the hospital and whether there might be other people in the mix in that place. And of course, today we've heard about a nurse who may or may not have picked it up from the hospital and her sister who are also positive. So sadly, it's reached a point where you do need to look at these measures just to contain things as you complete the mapping of the cluster. But this is certainly more serious than anything seen in Queensland out of that recent UK strain concern. And given it's a UK strain, I think, they've got no choice now. So it's just a pity you got to this point.
Yeah, and you mentioned one of the people who we believe has contracted COVID-19 was a nurse. Is this another reminder of the need to speed up the vaccine rollout for our frontline staff?
Look, absolutely. I mean, the Chief Health Officer in Queensland was saying that they don't know whether she actually picked it up on work. She's been on leave recently, and so we don't know that for sure. But clearly, the more people vaccinated, then the less chance there is that this will happen. That first doctor may not have been infected if he'd been vaccinated. We don't know. It's still early days in the vaccination program. People are only now just getting their second jabs on the front line, but every jab makes a difference. And once we get that more widely in the community, it not only means the crossover and these early cases could be more contained, it also lessens the risk in the wider community. But we're not there yet.
So when are we there? How long do you think before? Are we talking weeks, months of the AstraZeneca rollout before we start to see? I know in Israel there's been a huge decline in cases and all the numbers are looking very promising, but they've had a really quick rollout. How soon before we start to see an end to these snap lockdowns?
Look, it's a good question. I was hoping that we had already seen the end of the lockdowns, that if we did identify any crossovers at the border, we'd identify it faster because we've now got more regular testing. But of course, this didn't happen in hotel quarantine. This actually happened in a hospital setting. And again, we still don't understand how this cluster relates to that event, or if it relates directly to that event or some other event associated with the same sort of cluster of people with this strain. So until we know what happened here, we really don't know how to prevent it again and how likely it is to happen again. But I do think, our borders with regular testing hopefully mean that a combination of less likelihood of transmission occurring at the border, less likelihood of that being missed for any period because we're testing so regularly, daily, on shifts, that we can get on top of these much faster. But this might have been boiling along in the community since the 9th. So we're now talking, a number of days between cases that we can't explain. And that's the real concern, that there could be other cases out there. So hopefully 3 days will be enough for them to really assess the situation and make sure that there's no worrying signs that there are more cases to be found or that the transmission's wider than they realise.
Professor Bennett, given the success, the efficacy of the vaccines, will there have to come a time where our governments will, if all of the vulnerable people and those on the front lines are vaccinated, that we say, okay, that's it. In terms of livelihoods around the nation and so on, that we accept a certain level of COVID like we do influenza?
Look, I think that's right, Kieran. I think we'll still want to monitor and prevent certain variants getting into the country. So the P1 variant that we're hearing about, the South African variant now causing a lot of problems in Brazil. But if you're talking even the UK variant, it's contagious, but it hopefully is largely covered by the vaccine. And so we're still protecting us as a population from serious illness, then I do think it reaches that point where you have to. It changes the scale, doesn't it? So you have to weigh up the health risks, which are diminished because you've got most people who are vulnerable vaccinated, and those greater economic costs that we all acknowledge have their own risks, including health risks associated with those. So it shifts the balance, and I think that's what we have to have, those bigger conversations, given that the vaccine program isn't going to be one that can be done and dusted, by the middle of the year, and maybe not even by October for that second dose, but we might decide before we reach that full vaccination, full second dose, as you say, as long as we've got the right people covered, then I think it's time to start the conversation about what we then do as our next step with our borders.
Professor Catherine Bennett, Chair in Epidemiology at Deakin, thanks so much as always. Appreciate it.
Thanks, Kerry.